Hello and welcome, everybody. Thank you for joining us at Trilogy Wellness for a special presentation of cannabis as a medicine, unlocking the healing potential. My name is Dan Taylor. I'm a marketing coordinator here at Trilogy Wellness, and today we're going to dive into the world of cannabis, how it's changed the lives of millions, and the warning and side effects you should know about should you choose to explore the benefits. So joining us today, we've got three nurse practitioners. First, Renee Reziger. Am I saying that right, Renee?
Yes, Renee Reisinger.
Thank you so much. Is an adult nurse practitioner certified by the American Association of Nurse Practitioners. She's also a board member of two nonprofits, Veterans Initiative 22 and Maryland and National Americans for Safe Cannabis Access. And of course, she's a very proud veteran spouse. She earned her MS at the University of Maryland School of Pharmacy and her medical science and therapeutics master degree at College Park. Welcome, Renee.
Thank you.
Nicole Mitchell is a board certified family nurse practitioner, certified by the American Academy of Nurse Practitioners. She graduated with honors from Hampton University. She founded and owns Halo Wellness Clinic, where she and her staff help educate former patients about the benefits of cannabis. Her clinic will serve patients in the Maryland area, from pediatrics to 11 years to the elderly. Nicole is affiliated with several organizations, including the American Medical Marijuana Physicians Association. And we also have Amanda Nixon. Amanda's a family nurse practitioner with board certification from the American Academy of Nurse Practitioners. She, after completing her Bachelor of Science in Nursing from Salisbury University, she gained extensive healthcare experience across multiple platforms and domains, including neurosurgery, labor and delivery, women's outpatient home health care, urgent care, and travel, and as a traveling nurse. She completed her Master's of Science in Nursing from Chamberlain University, and she founded Maryland Green Consulting LLC, a wellness practice that's aimed at providing safe access to cannabis for patients' betterment. Amanda is a member of the American Association of Nurse Practitioners, American Cannabis Nurses Association, and the Society of Cannabis Clinicians. So today, folks, what we can say is we've got some experts on hand to answer your questions. Some of you may be waiting here in our lobby, wondering if cannabis is for you. And so we're going to get not too much into the weeds, but talking about cannabis as a plant, and really kind of what's right for you. How does this all work? So what we're going to learn on this is we're going to learn several things in this discussion. We're going to get into the legality, regulation. We're also going to explore medical uses and benefits, potential risks and side effects, and there are some, patient access and education. And at the end, we'll kind of get into a conclusion and a little Q&A with our three medical experts. So let's go into the history of cannabis. It's been used for a long, long time. Some believe as long as 12,000 years ago when it was first discovered. 19th and 20th century pharmaceutical products, widely used as medicine for patients. But then as we got into the 1900s, things changed and changed rapidly. Criminalization, prohibition in 1937 and 1970. Maryland, we finally did it. 2023, we went adult use in July. And right now we've got 38 states have legalized cannabis for either medical or adult use purposes. So we want to get into one area of the body that obviously is going to really get into cannabis, how the body works, but we're going to explore what's called the endocannabinoid system. We want to start there. And Nicole, I want to begin with you. Explain to an average patient what the endocannabinoid system does and why it's so important for them to know about it.
So typically when a patient comes in to see me, they ask, is cannabis really right for me? And a lot of people are shocked that you actually have endocannabinoids all over your body. This helps regulate, these are psychoactive, they can help with your immunity. So there's different receptors in your body. So when we do cannabis, it triggers those different receptors to alleviate a multiple different ailments in your body. It could be from cancer, multiple sclerosis, HIV, lupus, any autoimmune disorders, pain, even PTSD, psychoactive. So usually this is where I start off with the patient because they want to know if it's right for them. And I was like, look, we all have these receptors. And it doesn't hurt to try it, especially if you've tried conventional medication and it doesn't seem like it's doing the trick. You know, cannabis is something that's natural. And what better way of using something natural in your body to heal some of the ailments that you potentially have going on. So I do kind of roughly go over that. Some of my, people who are really involved in it, I go a little bit deeper, but to know that there's cannabinoids in your system, it does tend to trigger somebody. Like I could definitely use something that my body already produces.
Renee, when you see a patient that looks at the endocannabinoid system, are they a little surprised that this actually exists?
Yes, and I think as providers, many of the providers are also surprised about this. I'm an older healthcare provider, and when I first started to listen to patients describe their journey of healing with cannabis, I tried to start to educate myself. And I attended one of my first conferences. I heard a physician speak about the endocannabinoid system that was discovered in the 1990s, and I was stunned. I was kind of raised and schooled and educated in Western medicine, and I love to read medical information all the time. I couldn't believe I had never learned or heard of the endocannabinoid system. This was in 2017. So when I discuss this with patients, like Nicole said, I try to educate that every system in your body is the master regulator is the endocannabinoid system. So it's important that as providers, we start to learn about this in our programs and talk to our patients about it. And the endocannabinoid system, the hypothesis is that when your body doesn't produce enough of its own internal or endogenous cannabinoids, that's when we become unwell. And our body produces two internal cannabinoids that respectively are very similar to THC and CBD, which we've all are pretty familiar with, I think, when we think of cannabis. Anandamide is very chemically similar to THC. Another chemical that our body produces, 2-AG, is very chemically similar to CBD. So the hypothesis is when we don't feel well, we're in an endocannabinoid deficit. And the quick Band-Aid fix is plant cannabis. And I really like to, educate, especially our older patients about this, because there's such a stigma and a shame attached to using cannabis. And then there's also the fear of losing a job, for many people. But I like to wrap it around and compare it to a diabetic using insulin. Diabetics use insulin because their pancreas doesn't produce enough insulin. Would we ever shame a diabetic for using insulin? No. So the stigma of using cannabis as medicine needs to go away.
Amanda, your thoughts on just what we've been talking about with the endocannabinoid system?
I just to tag on to what everybody said, there's over 100 cannabinoids in the cannabis plant that can be beneficial in supporting the endocannabinoid system. I think our patients just need a lot of education that this is a natural way that they can help support their health. And there's also other holistic practices that they can implement in terms of diet with omega-3, omega-6 fatty acids, proper night's sleep, exercise, singing. So there's a lot of things that they can do as well to help.
Yeah, I think one of the big things that we're starting to see as we move on from the endocannabinoid system is just the cannabis family. What we're seeing, there's typically three types: indica, sativa, and hybrid. The indica being the more, in the couch lock, sativa being more uplifting, and hybrid a little bit mixture of both. But Renee, you kind of pointed out when we had spoke off camera, it seems like the THC keeps climbing. And I know people here in our lobby who are watching this, some people may be going for that high THC. What do you say?
So I think when the recreational market started, we saw more more high THC content into the recreational market. For medical users with THC, what we suggest is the lowest amount of THC that relieves symptoms so that you're not so high that you can't function. So I think maybe that would be a big difference between the medical and the recreational.
Nicole, when you're looking at these large amounts of THC, the CBD, a lot of people will, not will kind of poo-poo the CBD and say, well, I just want the high stuff. But that CBD and THC mix, especially in flower or any type of cannabis product, is very important.
I agree. Typically my rule of thumb, I always say start low, go slow, start low, go slow. And some people do want that high. And even though I wasn't born back in the Woodstock days, but the THC, the CBD, it didn't go any, maybe 1%. And you still got the effect off of 1%. Now we're seeing so much higher doses, but you can still get the same effect with lower dosing. And I tell the patients the goal is not to be high, but the goal is to correct whatever ailments that you have going on at the lowest dose possible. And then you have some room to maneuver, go up. I even do micro dosing for a lot of people who are really cautious, especially the elderly, as far as doing too much. So unfortunately, there's that push, but again, the goal is not to get high. The goal is to correct whatever medical ailments they have going on at the lowest and effective dose.
Amanda, with your patients, are you seeing a hesitation towards lower, higher THC, or are they kind of coming to you saying, I've never done this. I don't know if I want to smoke it necessarily. Maybe I could take it orally, topically. What are you kind of seeing? What's that discussion like with your patients?
I think people that are new to cannabis or cannabis naive are more open to education about having equal parts THC and CBD, especially patients that have chronic pain, because that feeling or that high, that feeling of euphoria doesn't necessarily indicate effective correction of symptoms and relief. So I think newer patients tend to be more open to that conversation about the implementation of CBD.
Yeah. I want to move on and speak about medical uses and really the benefits. And Amanda, I'm just going to start back with you talking about, pain management, neurological. It kind of runs the gamut of what we're seeing, what this plant can do. What are some of the symptoms from patients that you're seeing almost on a consistent basis, and what are they getting in return after they pursued cannabis?
So I would say the number one thing the patients come to see me for is chronic pain, hands down. Arthritis, migraines, neuropathic pain, fibromyalgia. And it's reported that 1 in 5 Americans do have some form of chronic pain. So I would say that's the number one thing that people come to me for. And then I would say anxiety and depression secondarily. And the concept of using cannabis for pain relief is not new. I mean, it was used in China centuries back for rheumatic pain. It was used in India for analgesic purposes. Queen Victoria used it for menstrual cramps. So I find that once they are on a good treatment regimen, a lot of times patients can start to wean off of some of the over-the-counter or prescription pain medication that they're on. And I believe that some studies have shown that between 64 and 75% of patients are able to reduce opiate amounts and frequency once they are on medicinal cannabis.
Wow. Renee, I'm going to pivot to you for a moment. What are you seeing too with some of your patients? Is it across the board? Is it more like Amanda said, more severe arthritis, pain?
So I would agree with Amanda. When I started working in the cannabis industry, most of my patients were looking for chronic pain relief. And then as I worked in the industry, I started to see like this triad of chronic pain users. They don't get a good night's sleep, so they suffer from insomnia. They don't get that good REM restorative sleep. You don't sleep, you're in pain, you wake up. It causes anxiety. Sometimes it causes depression. So once you educate patients and they have access to the medicine that they need to help control their pain, and once they start to get a good night's sleep, they get a better quality of life. And I think that's what cannabis is about, improving quality. You know, well, how is your blood pressure? You know, are you still on metformin, insulin? You know, how's your glucose numbers? And what I've discovered is a secondary gain to cannabis, that once people start to feel better, then their hypertension is more controlled. I'll ask if renal function is normal. There is a mechanism of action with cannabis where it's a vasodilator. It functions like one of our blood pressure medicines. So people are getting improvements in their blood pressure, kidney functions are normal. And then I encourage patients to have a conversation with their doctor about hypertension management. And for those that are on 3 or 4 hypertensive meds, you know, can they cut back, wean off, monitor their blood pressure at home? And I was very pleasantly surprised to see my diabetic patients come back and tell me that their glucose levels were more normal, their hemoglobin A1C levels were more normal. And because they're going for follow-up more frequently with their doctors, a lot of the patients, when they would come back for recertification in a year, were off their metformin, half their insulin, because they're feeling better, they're up moving, they've had weight loss. And, you know, people walk in and they're just like overjoyed at the better quality of life they got using cannabis.
Nicole, are you seeing that too with your patients, that some people are either coming off of their medication totally or being reduced on some of the medication?
Absolutely. And my primary is gastroenterology, so I do work with a lot of GI issues, especially with nausea, vomiting. So those anorexic patients, those patients tend to benefit a lot. I also see a lot of cancer patients. So I do see a benefit of being on some of these other medications when we've tried several other medications in the past, and it just doesn't seem like it's doing the trick. And then I would just kind of put a little bug in their ear. And, you know, and I never push anyone to want to use cannabis. I was like, look, here's a little bit of information. We've tried this medication. We've tried that medication. It doesn't seem like it's really working very well. You know, why don't you give it a try? You know, you can go slow. You can just take a little bit and see how you feel. And then you can always recircle back, and then we can discuss a little bit more how we can manage a lot of your symptoms by the use of cannabis and coming off of the triad of medications that they're on. I deal a lot with the elderly as well. And the polypharmacy with all of these medications is unreal. So having to come off of some of those medications, especially like the narcotics or the anti-inflammatories, which tear up the stomach, it piques a lot of individuals' interests, especially my elderly patients.
Right. I want to, and I know we're talking about the positives, obviously, with cannabis, but we also have to bring up, you know, potential side effects. And everybody knows that they're there. The psychological effects, respiratory, cardiovascular, you know, people with COPD. Obviously, here at Trilogy Wellness, anybody comes in with respiratory issues, we immediately move them over to either topical or oral, just because that's, you know, cannabis can be consumed in different ways, and that's what a lot of people are wondering. We're also seeing interaction with other medications, blood thinners being one that patients definitely need to speak with their doctor or provider, and then just public health concerns. And I think when we look at some of these, and Nicole, I'm going to go back to you. Are you seeing in maybe potentially younger patients where some of these issues are starting to creep up? Oh, I think we may have lost Nicole. I'm going to go ahead and pivot over to Renee. Renee, when you're looking at these potential risks and side effects, and you know, you've talked about you've been doing this for quite a while. What are you seeing with younger people? People tend to abuse it. What do you see happening, if any?
So when we talk about any substances and medication, we need to educate ourselves as providers and, you know, renew the use, risk, side effect, benefit, drug interactions, so we can have that conversation with our patients. Anything has risks. Too much water can cause water intoxication and death. So, you know, when we talk about cannabis, we do want to educate our patients as to some of the risks of cannabis. So if you have cardiac issues, like I discussed, cannabis can be a vasodilator, and it can cause hypotension and a reflex tachycardia. So you want to have that conversation with your patients that have a cardiac history. There can be a cannabis use disorder if someone is using cannabis to the extent that they're not meeting their day-to-day responsibilities and they're being irresponsible with their use. There's also something called a cannabis hyperemesis syndrome that I think is probably related to the high THC content, and we brushed on that a little bit earlier.
Mhm.
In our brain, we have CB1 receptors that are there, and they're ready to accept the THC. So that receptor in your brain, that CB1 receptor, think of it like an empty sand bucket, and then the THC is the sand. So once you put so much sand in that bucket, it doesn't accept it anymore. So when you're using the high THC content, you're really wasting your money because it's just going to swim around in your body.
Right.
And it can have some side effects, like I believe a cannabis hyperemesis syndrome, which can be quite dangerous. I had a family member experience this. And I repeatedly said, you're using too much THC.
Yeah.
So that also with pregnancy, you'll hear people say, well, we don't have the studies. Well, there was a study in Jamaica that a nurse did years ago that studied women in Jamaica using cannabis, and they studied for a 5-year period. And they studied it, and they found that there were no untoward side effects. And then the study got shut down. So, you can kind of like draw your own
Sure.
conclusions to that.
Sure.
So as we discussed, the endocannabinoid system, when you don't feel well, the thought is that, or the hypothesis is that you're in an endocannabinoid deficit. If you had a pregnant woman that was diabetic, would you tell her not to use insulin? Now, insulin can be dangerous if you use too much of it. In the same idea as a patient that's diabetic using insulin, we need to have these conversations with our patients. And there have been studies shown that there was a public health study that I found in the International Journal of Drug Policy, and it found that states that had medical and/or cannabis programs up and running for 7 years actually had positive outcomes. And one of the things they found is that there were a decrease in alcohol-related traffic deaths because people had access to cannabis, and there were lower traffic incidents with
Wow.
states where cannabis was legal.
Right. Wow. Nicole, I know we lost you there for a second. We were talking about the side effects, and I know you've seen some of your patients. Explain to me the age group you're kind of seeing, these psychological, respiratory, cardiovascular.
As far as the GI setting, I do see they tend to be on the younger side, sometimes the older, but it's more the younger side. They are now being able to get the cannabis THC at higher doses. So they come in and they're like, I have nausea all the time, I'm vomiting. Of course, you're like, okay, this is reflux or this is something else that's happening. And then when you dig a little bit deeper, you figure out, I'm like, okay, hey, do you smoke anything? And then that's when they say, yeah, I do smoke cannabis like all day long. Like when I say all day long, from the time they wake up to the time they go to sleep. And, and they're not convinced that this is what the issue is or what's causing, and Renee had mentioned the cannabinoid hyperemesis syndrome. And that's when I do tell patients, as much as I would love to talk to you about cannabis and the benefits of it, for you, I think you need to back off of it. And I do tell patients to refrain from using it for several months to see if this potentially might improve your symptoms instead of going through costly scopes to see if there's other issues when potentially it was probably the cannabis. Also with my respiratory, my asthma, my COPD patients, I say smoking might not be the best thing. And I say smoking as if you're smoking anything else, cigarettes or anything else. Yes, it's bringing things into the lungs that potentially could be an irritant. So yes, it can potentially have some side effects of exacerbating certain things. And I've had patients that said that it's benefited them as well. But the research is still kind of up in the air regarding that. But yes, there is a respiratory risk for that. So those are the two, I'll say, main categories that I do see regarding my patients.
Amanda, is that similar to what you're seeing?
I would say so. Mainly like people that use a heavy amount of flour, they can have more complaints with, respiratory irritation, the chronic cough. I do see some patients with mental health history, with, the anxiety, or even like some with bipolar disorder, where if they're not cautious with, THC levels, it can actually make their symptoms worse, make them more anxious, more paranoid, things like that.
Yeah. One thing that that we've seen too, obviously before the state went, medical and recreational, or actually it was after the state had gone medical, we saw the farm hemp bill go into place. And we know that even though CBD is loved by many of our patients when it comes to THC, it's still unfortunately not as regulated, and in some cases not regulated at all. And so I think one thing that people need to know about when it comes to their hemp CBD is they're not going to be, in depending on the vendor, if they put a COA label, if they want to do that on their own, they obviously can do that. But for the most part, people are going into grocery stores and to gas stations and buying these products that are unregulated. Renee, what are you seeing with some of your patients who talk about, oh, I don't want that psychoactive high, I want CBD. And then you kind of have to explain to them, yes, CBD is great, but you've got to know where you're buying it and what to look for.
I think it's very confusing to the public. And, just as we see the news broadcasting our sporting events and talking about that, I'm looking forward to the day when I see people like Nicole and Amanda on the news discussing cannabis as medicine and hemp and educating the public. There has not been widespread public education, and people are confused about, well, why can I get hemp CBD and then I need a card to get or approval to get medical cannabis? It's because of the 2000 Farm Bill. So fortunately, we were able in the US to have the hemp experience. It was rolled out as a supplement, which means it's not regulated. So it's buyer beware. All of these plants are special. The hemp, which is Ruderalis indica sativa, when they're planted in the ground, they're called biosynthesizers. The roots pull contaminants out of the soil. When the Chernobyl meltdown happened years ago, and many people that are young probably don't remember that, the Soviet government brought in hemp plants to pull the radiation out of the soil. So if you're going to use hemp, and I don't recommend hemp products unless it has a certificate of analysis, because I want to know that I'm recommending something that is safe, which is why I'm involved in the Maryland Cannabis program, because I think Maryland rolled out a very excellent medical cannabis program, and I think the products, for the most part, that are sold in the dispensary are safe.
Yeah. Amanda, what are you seeing with your patients who are interested in CBD? I guess you have to caution them the same way as be careful at the grocery store and gas stations picking up stuff that says it's got THC in it.
Yeah, I definitely make sure that they know that they should look for products that have been quality tested, that come with a certificate of analysis, and to just do their research on where they're buying from.
Yeah. And I think a lot of it too is just education. And I'm sure, Nicole, you've had to spend time with patients about not just, the THC part, but the CBD part and where they can go and find it.
Yeah, I've been, I'll give a good example. My mother. So she was just like, oh, I want to use all this stuff. And she buys all these things from like QVC, some CBD, and she goes in these stores and grabs all of these different things. I was like, you have to make sure that it's really certified and that it's patented, that you can actually really use this, because it could be a lot of filler. It's like almost taking a Tic Tac for pain. You might potentially get a little bit of a, almost like a placebo effect, but not really doing much of anything. So you do have to vet patients and making sure that they're getting it at the right place. So they're not being ripped off, and they spend a lot of money on stuff that really doesn't do anything. It's garbage.
Yeah, and that certificate of analysis we were just talking about, it really is going to have everything in there. It's the terpenes, the cannabinoids. It's going to show you if there was metal detected. Did it pass? Did it fail? That sort of thing. And so it's Trilogy. Those are all the things that we too are looking at as those COA labels, and to make sure that everything is buttoned up from the processor to the grower. Everything by the time it gets in, you can take it. It's kind of the same situation with COA with the FDA requiring stuff on the back of labels. You want to know what's going into your body. It's the same kind of principle. And so those COA labels, as folks in the lobby are watching today, are very, very important. And you can always scan the back of your product. There's a COA label in there, and it will pull everything up on what you needed to know about. So I want to get into the ways we consume cannabis. And I know you guys have had multiple patients come and they either say, I don't want to get too high, or I don't know what to do. My doctor told me to come. Amanda, I want to start with you. They come, they're interested in cannabis. What do you recommend?
Well, I first want to get a thorough history on what are we treating? Like obviously a patient that's suffering from nausea and vomiting, I'm not going to probably recommend an oral gummy. And then with them about, it's still a respiratory irritant. You still need to be aware of that. Do you also smoke tobacco? Because then that may also increase your risk a little bit further. And I just sort of explore all the different options because it's a lot and it can be very overwhelming to patients.
Nicole, what kind of approach do you take with patients? Because like Amanda just said, it can be a lot.
Yeah, I mean, just like how this chart is really colorful, I almost tell patients going into a dispensary is almost like going into a candy store and you've never had candy before. You're like, do I do chocolates? Do I do this? Do I do that? So I do try to educate a lot. I give little pinwheels with all the little fancy colors. And you might want to look for something that has a CBD or something else, or what is your what is your medical issues? And just like Amanda was saying, if they're having something regarding GI issues, maybe oral is not the best thing for you. Or if they're having issues with anxiety, panic attacks, maybe the flower might be a little bit better option for you just because it works so quickly in getting to the site to help calm you down. So it really depends on the medical condition that's going on with the patient, which will guide me as far as which one might be right for them. And I also, when I tell them to go to the store, don't go crazy. Don't go getting $500 worth of products because you don't know if it's going to work or not. Try maybe 5 gummies. You can always go back and get more. And this is a tinkering thing. You're gonna probably go through a lot of different products before you find that right one. But once you find that right one, you're good. Usually you're pretty good. So.
And Renee, when people find their sort of sweet spot, what Nicole was talking about, how great is that once they come back and you said, hey, I want you to start off with some tinctures, or like Nicole said, I want you to start off with 5 gummies. They're 10 milligrams. Once you cut them in half, do that for 2 weeks. What's that feeling like when they come back in and say, Renee, this is working?
It's a wonderful feeling, as a provider, when you can, go on that wellness journey with patients. And I think, Amanda and Nicole did a great job breaking down the different methods of administration. And I always like to emphasize with people that are going to use this orally, whether it's gummies or whether it's edibles, when you start to swallow the THC, unlike when you smoke it or use it sublingual, the tincture drops, the onset of action is pretty quick because it gets right into your bloodstream. But when you swallow the THC, it goes to your stomach. The onset of action may, depending on what you just ate, if you ate a diet high in fat, it may get absorbed quicker because these are fat-soluble molecules. So the onset of action may be 30 minutes to 2 hours. And for people that are used to that, smoking THC high, you may find oh, nothing happened. You say you take more, nothing happened, you take more. Your liver metabolizes that THC molecule and makes it 4 times as strong. So, I think like Amanda and Nicole said, start low and go slow. If you have like too much THC, it may cause an anxiety panic attack. And I always emphasize to people, this isn't an opioid. You're not going to stop breathing. There's no receptor in your brainstem that's going to cause you to stop breathing from too much THC. But if you have an anxiety panic attack, it's a couple uncomfortable hours you won't get back. And we want people to feel better, not worse. Right. And then from what I have read, one thing that will help with that THC anxiety overdose is CBD. It helps dampen that CB1 receptor and tamper down. It's like dimming a light switch is what I've heard it described as.
You know, we had talked earlier about so many groups and doctors and nurses and PAs and nurse practitioners who are coming on board and really getting behind cannabis. And 2 groups are really supporting. In fact, they've already come out. And Renee, we had spoken about this through several email exchanges. The American Nurses Association and the American Association of Nurse Practitioners have both come out in support of cannabis in a medicinal way. And this has to be pretty big. And any of you can kind of jump in on this topic. The fact that these 2 organizations have come out and endorsed cannabis, what does that say of where the industry is going, at least in America?
So, having been in the healthcare field my whole life, I feel very inspired, by what our nurses are doing and what we're bringing to the table. And one thing that I had read by Dr. Dustin Sulak, who is one of the leaders in cannabis medicine, clinicians are increasingly realizing that both government regulatory and medical authorities cannot be implicitly trusted to do what is best for our patient outcomes. As we explore the existing research on cannabis, please recall the propaganda and betrayal that deprived clinicians and our patients of a safe and effective treatment option for decades, resulting in immeasurable suffering and injury. So to be part of this journey to wellness, where we're working with one tool in the clinician toolbox that can help people feel better, and it's been denied for about 80 years.
One aspect of this conversation that we're having is really comes down to patient access and education. As you guys have been talking through this, education seems to be the biggest barrier for some patients going in and asking, what do you think about cannabis? Is this something that I could use? How are you guys kind of going through, and obviously not dumping everything? And Nicole, start with you. If somebody comes in, they're like, oh my gosh, I think I can do this. I think I want to try it. What are just a couple pointers you're giving them?
I just basically try to get where their education level is, because that's going to kind of guide my direction as far as how much information they're able to handle. Usually when you're communicating with a patient, you can kind of get a good idea as far as, I think whatever I'm telling you is going to be sensory overload. Let's come back. And I like giving them educational information to read. So, but why don't you read on this? We only retain a certain amount of information. When I spit it out, you're only going to be retaining a certain amount anyway. So here's some information. Why don't you read it? If you have any questions, you can always get back to me. I like writing things down. So usually that's my approach to the patient. And I just like to put little nuggets in their ear. And 90% of the time they end up coming back and, hey, can you tell me a little bit more about this? I did do my education. I did do my research. And then we're able to have a, one-on-one conversation, meaningful one-on-one conversation of what the next steps are going to be.
Amanda, are you seeing that with your patients as well? As sometimes they want to talk about it first, maybe not necessarily go get the medical card, or not even having to get the medical card? Are they kind of apprehensive? What's your experience been like?
Some patients are apprehensive, and I find even too, just when I'm out in the community, just having those casual conversations with people that are interested but haven't taken that first step is you just become aware of how much the stigma is still present, and just not only giving them education or tidbits of education about cannabis, but just reassuring them that if they're a mother or a veteran or, just anything that they see as minimizing their role in society, that cannabis doesn't take away from that, and that it is a viable treatment option for so many different ailments. So I definitely still see the stigma in a lot of patients that I talk to.
Renee, what about you?
So, especially with the older population that grew up with the stigma, and I have an older family member that I knew was really going to benefit from using a CBD product with a certificate of analysis because she'd experienced some pretty impressive weight loss. And even though through the years, I've talked to her and educated her, it wasn't until she was with a peer group, a group of church ladies, I think, that she was at lunch with. And she was telling this group of women, that she wasn't feeling well. And then she came to me and she said, I'm ready to try the CBD. So, I think it's important too to get out, educate people, because some people just aren't going to believe anything about cannabis until they hear it from somebody like a peer group that they trust. And then as far as, patient access, as nurses and nurse practitioners, this is something that's so important to us, is access to care. And I'm sure the other two NPs would agree with me that we all want to see improvements in health disparities and health inequities and patient access to care. And I think that we need to be acutely aware that in 37 states, we've rolled out medical cannabis programs that patients need a disposable income to afford. And then, I think I sit back and I think, who are we, as a nation where we've rolled out a wonderful treatment modality that's high benefit, low risk, but you need a financial disposable income to afford it. So there's a lot of work to be done because, like our beloved Congressman Elijah Cummings said, we're better than this. We have to do better than this.
And, Dan, I wanted to just add on to that. I did a seminar at my church. I guess seems kind of oxymoron a little bit, with the elderly regarding cannabis. It was probably at least 50 or so people there. And these are all elderly patients. And, at first they were really apprehensive of no one wanted to say anything about it. And then one hand goes up, then another hand goes up, and they're like, yeah, I did try that. And yeah, back in the day, yeah, I did a lot of, so it's not like they've never done it. And it opens the floodgate to yes, this might be something that I can use. But I went to them. I went to those areas. This is in DC. So I went to those areas where, this is a comfortable place. This is a safe place. And I made sure that they were aware that this was an open forum, that none of this information is going out, but this is just an area where you can feel safe, where you can talk to a professional regarding potential some of your concerns.
Amanda, final thoughts on just the conversation we've been having today, and maybe those who are watching in our lobby, something that they could take home to remember.
Well, we've made strides with cannabis, and we're living in different times. It definitely can be a great tool with enhancing your wellness. Start low, go slow. Make sure if you have kids at home or pets at home, you lock up your medical cannabis for safety and don't drive when you're using. But it's just an honor to be part of the presentation today.
Thank you. Renee?
Thank you. Thank you for putting this together. I think what you've done is so important.
Great. Well, I appreciate everybody here in our lobby taking the time to watch this presentation today. We'll replay it several times in the next few weeks if you missed it today. And maybe we'll write a little article up on our website. That way you can read a little bit more about it. So I thank all of our guests today for joining us, for myself and for all of Trilogy. We'll see you next time.